Hi, my name is Dr. Iraj Kasimi from Hillcrest Dental. We get a lot of questions about restorative dentistry, so I'll be answering some of those questions for you guys today. So, restorative dentistry refers to the restoration of teeth that are damaged due to some reason. It could most commonly be cavities, or also known as dental decay. It could be trauma related, where it's broken due to an accident. It could also be long term wear and tear due to abrasion or attrition from just long term use of the teeth. So restoring a tooth is basically fixing a tooth due to one of those reasons. So the difference between restorative dentistry versus cosmetic dentistry is we're restoring a tooth due to damage that has occurred on that tooth, whereas cosmetics is simply enhancing the appearance of teeth for cosmetic or aesthetic purposes. Now you can have a combination of the both. Sometimes we do restorative dentistry, and one of the reasons is also cosmetic, but there's also other needs for it which require restoration. So you can have both. You can have a situation where you need both, or you can have a purely cosmetic case where you're just trying to enhance the teeth where there is no damage. What conditions would require restorative dentistry? It depends on the type of damage that you have. So if there's a cavity that's not very large, sometimes we simply will do preventative dentistry or monitoring that tooth. If it's a cavity that's gone through what we call the dentino-enamel junction, where it's getting deeper, then we could start out with a filling if it's not too large. Now, if it's a tooth that's had a significant amount of damage to it before, or if it's a tooth that already had a filling that's very, very large and we can't do another filling because that would compromise the tooth, that's when we would look into a crown. So, there are various levels of how large or encompassing they need to be, depending on the damage, yeah. We almost always will use local anesthesia, so there's no discomfort. We can do sedation if necessary in certain cases. We offer all levels of sedation in our office, including nitrous oxide, where you can drive yourself home after. We have oral sedation. We also have IV sedation and general anesthesia, where we actually bring in an anesthesiologist. So we have the full gamut of what is needed to get you comfortable and relaxed. Some of the benefits of restorative dentistry include saving your tooth, preventing the damage from getting worse, also enhancing aesthetics or cosmetics of your teeth. The goal is to save your tooth and always be conservative and do the at least amount of treatment that's needed in order to restore a tooth. And we'll just do whatever's needed to save that tooth and protect it so you can use it for many years to come. There aren't too many risks associated with it. One of the common ones is, if the cavity is very deep, sometimes we get close to that nerve and there's a possibility that the tooth may end up requiring a root canal if after the procedure there's a lot of pain or if the sensitivity is not going away. But that's something that can happen with any restorative procedure, especially a crown preparation, or we do a crown. Not as common with fillings, but it can happen with fillings too. But other than that, there's not too many risks. Obviously, there's all kinds of things that potentially could happen that just don't happen because they're so extremely rare. So it's a very safe procedure to get done in order to save that tooth. After a restorative dental procedure, typically the tooth may be somewhat sensitive for a few days, but it's nothing that should prevent you from going about your day. So you really shouldn't. We have patients who come in, get a filling or crown done, and then they go straight to work right after. So there's not really any downtime, but it is normal to experience some sensitivity immediately after, which gets better and better over time. The success rate for restorative dental procedures is extremely high. If we have a scenario where the cavity is very, very large and we go in and do a crown in that case, there are certain times where we're not sure if we're able to save that tooth. We let the patient know ahead of time we're taking a chance here, and sometimes it might be better off to just consider replacing it with an implant for a more sure bet. We're very careful. Like when we diagnose something, we pretty much want to make sure that that's going to work 100%. So I would say the success rate is very, very high, and you should be able to keep that restoration for many years to come. The best way to schedule an appointment would be to visit our website, hillcrestdentallv.com. You can request an appointment on the website. You can also call us at 702-395-1088, or you could schedule an appointment online directly.